Welcome back to the Breast Cancer Wellness Summit. Our next guest, Kelly MacMillan, is an advocate for breast cancer. She is also the former executive director of Susan G. Komen Sacramento. She has dedicated her career to policy change, community engagement, and ensuring that breast cancer research and resources reach those who need them most.
Kelly, thank you so much for being here at the Breast Cancer Wellness Summit. Your commitment to advocacy, to breast cancer awareness and fundraising in the nonprofit sector has been very admirable, considering the fact that you are not a survivor. Kelly, welcome.
Thank you so much, Edna. I'm thrilled to be here, and you're right. I am not a survivor, but I have had family and friends that have been deeply affected by breast cancer. My grandmother was diagnosed in the early 70s, and at that time, the radical mastectomy was the treatment, and it was so devastating to her. They took most of her arm and her chest area, and she had to relearn how to use her arm again. It was very impactful. And my aunt, who was told she had exploratory procedure coming up and woke up without a breast, never gave permission, was never told anything. So even though they survived breast cancer, the emotional toll was pretty severe. And of course, there was no support groups. There was no mental health aspect of any of this. So it was a lot of shame and secrecy around it. My best friend is a two-time breast cancer survivor. And in 2001, it was my first advocacy effort around breast cancer, where I put a team together. It was called Diane's Team. And there was about 40 or 50 of us that walked the Capitol for the American Cancer Society to raise money. We raised a significant amount and provided support for the group. So those have been kind of my intros and my whys to breast cancer.
Yes, I mean, those are some powerful pulls into this line of work, supporting and fundraising and advocating. One thing you mentioned about your family members is, there was a time when people did not discuss these things, and, living with the shame and embarrassment. I can only imagine what you experienced going through that and watching your loved ones go through that experience. So, Kelly, your dedication is admirable. Tell me a little bit more about your background in nonprofit and in advocacy.
Well, it's all intertwined. I've been involved in advocacy work, started out in political, actually. I was a political fundraiser. I did campaigns. I had my own business for a while, raising money for political candidates and initiatives. I worked in the Capitol for a long time. But the way I started in nonprofit was my church, actually, asked me to raise money for their Capitol campaign. And we were very successful. And also during this time, a friend of mine's young son, 3-year-old, was diagnosed with neuroblastoma cancer. And we started a little nonprofit to raise money for him and support their family. So that was kind of my entree into both. And I realized that I could use the skills I'd been doing for politics and to serve good, to make a difference for the nonprofit world. And around this time, I was offered a job at a trade association that had a nonprofit clients, and one of them was Save Ourselves, which was a breast cancer organization that's still around, that is a local Sacramento group that provides support groups. And with my family background, not getting support through their breast cancer journey, I knew that support groups are really important. So I was very excited to be able to be involved with Save Ourselves. We ran groups in for all different stages of breast cancer, because you don't want a newly diagnosed with a metastatic, you make the group specific for the people's own journey. We also had a group for women who spoke Spanish, and we had a group for lesbian women as well. Mm-hmm. And my connection to Komen came through that, because Komen provided the funding. We were a grantee of Susan G. Komen to support those to to provide funding for those support groups. And because I was a grantee, I went to their big race every year. I put a team together. I did, all their different educational opportunities. And I also went to Washington, D.C. with Komen. I was just a volunteer, but I got to go to Washington, D.C. and do advocacy work for breast cancer funding and for their bills. And I love that because I knew what a difference it makes. And it was really fun.
Now, which aspect around breast cancer awareness or breast cancer support do you enjoy more? Is it the advocacy or is it the nonprofit and the fundraising?
Well, honestly, probably the advocacy. Fundraising is it's not easy. It's very hard work, and it takes a lot of effort. And, I'm currently working for a lobbying firm right now that Susan G. Komen used to have help us with our bills that we did in the legislature. And I love the advocacy work of it because I have seen the impact it can have. We passed some bills when I was at Susan G. Komen. I became this California public policy chair and worked at state bills and local bills, and national bills. And the state bills, we were really successful. We actually changed laws. We changed a law that made sure that oral chemo was affordable for breast cancer patients. We also changed a law around the Every Woman Counts program that provides direct services and diagnosis and treatment. And they had an age limit on it. They only provided services for women over 40. And we changed that. We made it for every woman because we could see that younger women were getting diagnosed with breast cancer and oftentimes didn't have the resources to be able to go through the treatments. And so this program was there for them. It also didn't cover people who were having reoccurrence. And so we changed that law as well. And that was really, really exciting. And I saw the difference that it made, on a statewide level. You could really have a huge impact from the advocacy perspective.
Now, Kelly, when you became the executive director of Komen and Save Ourselves, what were some of your greatest challenges? And I know you already mentioned the fundraising, but what were some of your greatest challenges?
Well, yes, fundraising. Like I've been doing it for 30 years, and it is the core challenge, I would think. There's a lot involved, but that's a big part of the challenge. And you can't do it alone. You have to have partnerships. You have to have community. You have to have a good board of directors. You have to be able to show your success. When I give money to an organization, where is it going? What is it doing? And what kind of impact is it having? You have to be able to tell that story. It's really important. And, sometimes your challenges to fundraising come from outside sources that you don't expect. When I became executive director of Susan G. Komen, the year before, the national board had made a decision to not support Planned Parenthood. And those of us at the affiliate level were like, what? They're a great community partner. That's where we get our screening done. That's how we make a difference in the community, is partnering with, Planned Parenthood. And when they did this, it really impacted our fundraising hugely. I mean, it took years and years and years to overcome. They eventually did change their decision on that and change their position, but it was too late. The damage was done, and it took a long time to recover.
Kelly, I remember that, and you're absolutely correct. There was really, I'm going to say, no coming back from that decision. And, it's really evident in all of that how politics play a huge role in the success of nonprofit organizations. And I'm going to say it also highlights like women's rights. Like that was really around, that was such an impact, a blow to women, I believe, and who are some of the major supporters of Komen, of course. And so it was just glaring at that time how politics sway the support of nonprofit organizations. And then let's just say how nonprofits can be influenced by their politics, right? So, I guess when I look back at that situation, it makes me wonder, did Komen really want to align with, why do I keep doing this?
Planned Parenthood.
Yes. Did Komen really not want to align with Planned Parenthood, or did they really want to support Planned Parenthood?
Well, the decision was made in a bubble.
Mm-hmm.
So, there's hundreds of affiliates across the country, and the decision was made at the national board level.
Mm-hmm.
Just a few people made that decision and didn't think about the impact it would have across the country.
Mm-hmm.
And it had devastating effects. It changed everything with Komen, and it took a long time for them to recover. And they changed their policy because of that, and require affiliate input now on those kind of national decisions, on making decisions. Because, I'd been working in the Sacramento area, and as executive director of Northern and Central California, we partnered with Planned Parenthoods all over the state.
Mm-hmm.
They were a great partner.
Mm-hmm.
And to now all of a sudden say we can't, it made no sense, because that's where we were getting our screening done. That's where we were getting our information out. That's where, mammograms were taking place. And politics has an impact. And I'm concerned about the current political arena when it comes to nonprofits right now.
If there was one major economic reform that you believe could drastically improve breast cancer care, what would it be?
I'd have to say health insurance. Mm-hmm. So health insurance needs reform. Our premiums and our healthcare costs are too expensive. They're making a lot of money, and they're denying services and treatments, and the costs just keep going up. It's not sustainable. A breast cancer patient or a cancer patient should not lose their home or file bankruptcy because they've been diagnosed with cancer. Mm-hmm. It doesn't make any sense. We've tried healthcare reforms in the past. You asked about reforms. Of course, in 2010 was the Affordable Care Act, the Obamacare Act, which really expanded healthcare insurance. Prior to that, there was a lot of folks who didn't have insurance at all. Right. Mm-hmm. And so it opened that opportunity and improved healthcare outcomes because people had insurance. Yeah. It also provided preventive care. It covered preventive care like breast cancer screenings. It capped out-of-pocket costs. It protected people with pre-existing conditions, which were huge. Now, since that time, a lot of the ACA has been repealed or reduced. Some states don't even offer it. Luckily, in California, we still have ACA. Mm-hmm. And I'm concerned about the current administration. One of the first executive orders was to roll back the protections that ACA had under the Biden administration. And so that executive order was signed to that end. And it's concerning to see where healthcare reform is going to go.
When you talk about insurance coverage, cancer treatment, breast cancer treatment here in the United States is significantly more expensive than it is in other countries. What policies or what policy shifts could reduce the cost without sacrificing the level of care?
Well, again, hate to parrot this over and over again, but it gets back to a health insurance company. Mm-hmm. Our premiums need to be lower. We need to cover the costs and the treatments. The out-of-pocket costs are ridiculous. Sometimes you go to a treatment and you have no idea what's covered and what's not covered, and then you end up with this huge bill. Mm-hmm. And they keep collecting our premiums. We need attempts. And it's frustrating because the providers and the healthcare systems and the hospitals and clinics, they want to provide the care. It's the insurance companies that are denying the care. Every cancer bill that I personally have worked on, or that I've seen our clients work on, or organizations work on, mm-hmm. the major opponent every time is the healthcare insurance industry. They don't want to open up treatments. They don't want it because it costs them money, obviously. Mm-hmm. But what are our premiums for? Right. There's something's not fitting here. It's not working. Mm-hmm. And we've tried policies to kind of counteract that. One of the things that the health insurance company does is something called step therapy, okay, where they put you through different steps. So let's say your doctor orders this particular oral chemo.
Mm-hmm.
but the insurance company says, no, we want you to start with a lower cost chemo. Even though that chemo may not work, it may not be, or may have adverse effects. And so that's a step therapy that you have to go through to get to the treatment that you're supposed to have. In California, we have worked on that, and we have eliminated the procedure to get it approved. So if a doctor can say that this is the best medication to save their life, it's already working, or the treatment that you're saying we have to use is going to have adverse effect, they have to respond in 72 hours to approve it, or even deny it. They can still deny it, but you have to have a response, because oftentimes in the past, providers were waiting and waiting to get approval for a treatment that could save their lives, and time matters. So, that's just one example of a policy that can make a difference.
Now, let's just say someone's in a situation and they're put through the step process, okay? Now, the insurance company comes back and says, no, we're going to put you on this drug because it's less expensive, but the physician or the healthcare provider knows that it, like you said, it's not going to be effective. Would that be considered negligence? And
I would like to think so.
Well, and then what legal, I'm going to say, options would someone have if they were forced to go through this process? And, like you said, time matters. Time matters.
Yeah, it does matter. And the providers have a big voice in this opportunity. But, honestly, if a patient is misdiagnosed or there's medical negligence, filing a medical law malpractice suit is an option. I'm not an attorney, but you do have that option. There's a lot of things. There's damages for medical expenses. There's lost wages. There's pain and suffering, and potentially punitive damages as well for severe cases. And some of those misdiagnoses, include like a mammography results, or failure to order the necessary tests for biopsies, delaying diagnoses, improper treatment. And a lot of that is unfortunately healthcare insurance generated, right? So there are organizations out there that can provide services. There's financial support. I know Komen has a fund, Young Survival Coalition, the Living Beyond Breast Cancer, American Cancer Society. They have funds that help you with co-pays and that kind of thing to get you through the treatment. But there's also legal support too. We used to partner with a group called Cancer Care, and they specifically will help you with legal process through working with the insurance company, maybe working with a workplace issue. Also, even the American Bar Association has a cancer legal advocacy group that can help you find resources and or attorneys to help you through the process.
I asked that question also in regards to people that I've had conversations with. The first time they went to go have their lump checked out, it was, oh no, don't worry about it. Let's just watch it, come back. And, and then the person goes and there's something persistent in their gut where they're like, and the person has something persistent in their gut and they continue to seek medical advice. And, they could be 2 or 3 medical appointments in, and finally someone decides, oh yeah, let's biopsy this. And it comes back malignant, right? So that's where I'm asking, sometimes people are put off and told, oh, don't worry about it. Oh, let's just watch it, when it already is it at the time that they're seeking the support. That's all.
Yeah, that's negligence. And that's an opportunity to take action against it, and like I said, there's legal resources out there. And also too, you can always get a second opinion. You can always also talk to legally, you have that right. So if a doctor's saying, no, I want to wait, find another doctor. Trust your gut.
There you go. Kelly, how do you foresee the NIH budget cuts impacting the breast cancer community, or research around the breast cancer community?
The impact of NIH cuts, catastrophic. catastrophic.
Mm-hmm.
So research is vital. It saves lives. And the NIH funds cancer research through the National Cancer Institute,
Mm-hmm.
which the National Cancer Institute is the largest funder of cancer research in the world. In 2024, the allocation from NIH to the National Cancer Institute was $7.2 billion.
Wow.
That's huge, and that's allocated through Congress.
Mm-hmm.
So the current administration's budget proposal would cut the National Cancer Institute research by $1 billion, which would impact, grants that support research and clinical trials, which are really, really important. And some of those trials, help with new treatments and better understandings of biologies of cancer. It also helps develop innovative therapies and supports really high-risk research that lead to groundbreaking discoveries. Research is so key. From the time that my grandmother was diagnosed and treated in the early 70s to now is a completely different journey, right?
Yeah.
The detection is better. The surgery is better. The drugs are better. The therapies are better. We have breast cancer navigators now in hospitals. We have support groups. We have more focus on mental health. And all of this happened through research and clinical trials.
Yeah.
We still have a long, long way to go. People are still dying from cancer. And so we have to continue the research. It's very concerning to me what is happening with the new administration and their appointments. I remember attending a research symposium a few years back, and the thought was that we would eventually have a cancer vaccine in my lifetime or our children's lifetime, a cancer vaccine. Now, can you imagine in this current political, thoughts that are happening, that a cancer vaccine would even be considered, would even be looked at, would even be researched, would even be funded? It's hard to imagine that anything like that would be supported in the next 4 years. So, I fear that because of these cuts, we're gonna lose research and we're gonna lose lives.
And lose ground in the progress.
Exactly. There's a lot of cutting edges things that are happening, and there's a lot of new stuff in all kinds of cancer and all kinds of diseases. And to see us step back and lose $1 billion is devastating. It really is. But, I don't want to wrap this up on a negative note. I want to.
We're definitely not doing that. What we want to know is how we can empower the listeners and the viewers to become active. How could someone get involved, Kelly?
So, it's a little overwhelming what's happening right now, right, on a national scale. And so what I suggest when there's just so much coming at you is you pick the thing that's important to you. And if that's breast cancer and if that's cancer research, you find out who's your local legislator, who's your congressman, and you use your voice. You tell your story, especially as a survivor. It's really important to have survivors tell their stories. And you advocate and you connect, you make the phone calls, you send the letters, and you pay attention and you watch, and it can get overwhelming, but look at the opportunities. The budget right now is being talked about, and that budget includes that cut to cancer research. Well, there's an opportunity to reach out to your local congressman and say, I don't support cuts to cancer research. Please vote appropriately. So, you have a voice and it makes a difference, and people want to hear from you.
Thank you, Kelly. That made me want to jump up and down just hearing your speech there. So, because it's empowering, it makes people feel like there's something that they can do.
Absolutely. And if you're in California and you want to take action, the American Cancer Society has, they have lobbying days where volunteers can come up. Komen does it. A lot of cancer organizations do. And you can walk the halls and you can talk to people, and they want to hear from you, especially from survivors, because you've lived it, you've been through it, and you know what the impact is.
Kelly, thank you so much for being here. Your passion it's contagious. And thank you for sharing your passion for making a difference in this community. And I'm really appreciative of your presence, your words, your experience here at the Breast Cancer Wellness Summit.
Thank you so much, Edna. It's an honor to be here.